Hello, dear doctors, nurses, medical student, and healthcare team. How are you today? I hope you are well. Today we are going to talk about another question of cardiology. A 54-year-old man has a temperature of 39 degrees Celsius. The patient is febrile, a new murmur, and cardiac failure. A new murmur. He had a dental extraction several days ago and a history of dental extraction. What is the single most likely reason for his symptoms? A. Atheroma. B. Congenital. C. Regurgitation of tissue. Regeneration of tissue. D. Infection. E. Neoplasm. And the answer, according to the patient history, sign and symptom, is most likely infective, and infection is the choice. Here we are going to explain it. Okay. Dental extraction is a known source of infective endocarditis. Infective endocarditis. Fever plus new murmur is endocarditis until proven otherwise. Risk factors of infective endocarditis is well replacement or recreation drug abuse and invasive vascular procedures. As we can see in this patient, he had dental extraction few days ago. Now, dentistry interventions are a common cause of bacteremia leading to infective endocarditis, and the cause is strep viridans, which is responsible for more than 35% of infective endocarditis. Presentation: septic signs like fever, rigors, night sweats, malaise, cardiac lesions like a new murmur, immune complex deposition like Roth spots, which are boat-shaped retinal hemorrhage with pale center, as we can see in these patients. We have Roth spots, which are white center retinal hemorrhage, splinter hemorrhage, which are small reddish brown or black linear strikes that appear under their fingers or toenails, and as we can see here, it's showing splinter hemorrhage, and osler nodes, which are painful, tender, raised reddish purple nodules typically found on the pads of the fingers and toes. Here we can see osler nodes. Okay, and embolic phenomenon, example Genevieve lesions, which are painless palmar or plantar macules, as we can see in this patient. All these Roth spots, splinter hemorrhage, and Genevieve lesion and osler nodes can be seen in patients with endocarditis. And some patients may present with congestive cardiac failure. Diagnosis of infective endocarditis is we have two criteria: major criteria and minor criteria. If we have two major criteria, or one major and three minor criteria, or five minor criteria is present, the diagnosis is confirmed. What are major criteria? Major criteria is positive blood culture and positive echocardiogram findings, like abscess formation or new valvular regurgitation, as we said in the patient's history. These are two major criteria: positive blood cultures and positive echocardiogram findings. And minor criteria: IV drug users predisposing heart condition, fever more than 38 degrees Celsius, vascular phenomena, as we said, like major embolic, clubbing, splinter hemorrhage, Genevieve lesions, and immunological phenomena like glomerulonephritis, osler nodes, Roth spots, and microbiological evidence which does not meet major criteria are considered as minor criteria. We have here modified Duke criteria for infective endocarditis, which has mnemonic, which is B timer. B is for major criteria and timer is for minor criteria. Major criteria, as we said, mnemonic is B. B is for blood culture positive more than 2 times 12 hours apart, and E is for echocardiographic evidence of endocardial involvement. And timer is for minor criteria, as we said. T is temperature more than 38 degrees Celsius. E is for immunological phenomena, as we said, like ocular nose, Roth spots. And M is for microbiological evidence, like positive blood culture, which are not meeting major criteria. And E is for embolic phenomenon, like arterial emboli, septic emboli, conjunctival hemorrhage, and painless skin lesions. And R is for risk factors, like congenital heart condition or IV drug users. We have definitive diagnosis if the patient has 2 major criteria, or 1 major and 3 minor criteria, or 5 minor criteria. The diagnosis is definitive, but we have possible diagnosis if the patient has 1 major and 1 minor criteria, or 3 minor criteria. It was a short explanation about the patient coming with infective endocarditis. Thank you for your attention.